Hi, my name is Jessie. I'm a doctor of physical therapy at Resonant Frequency Medicine, and this is a self-mobilization technique that utilizes a Courgeous ball, or you could use a rolled up towel or a small-ish pillow in order to perform some self-visceral manipulation, especially after a session where you've gotten some frequencies to help dissolve and break down adhesions and scar tissue in the abdominal viscera during a session. This is best done within 24 hours after your physical therapy session, and I hope you enjoy. This technique can be done either on a floor or on your bed, or if you have the luxury of a treatment table, that's the best because the level of firmness is just about perfect for this exercise. Your Courgeous ball is not fully inflated. It's a little bit deflated for this exercise, and it just helps with comfort and the ability for your visceral tissue to sort of melt around the ball without it being too firm. So to start, you would lay on top of your Courgeous ball. And for some people, being on forearms is comfortable. If that's not comfortable for you, you can bring a pillow or you can bend one knee and rest your head on your arm like this. Now, you're looking for a position over the ball. You might have to roll around forward or to the side, and you're palpating in this way for a position that has a little bit of tenderness, a little bit of discomfort. And if having all of your weight on the ball like this feels like too much, then that's a good time to just bend one knee up, and that will unweight some of your body weight off of the ball. So you're looking for an area in your gut that's a little bit tender. It's just got some little tenderness. And so you find that space, you linger there, and then you do the very best you can to breathe down into your belly. And then as you exhale, you imagine like that you're ice cream melting on hot pavement, or you're just softening and melting and relaxing over the ball. And you repeat this breath about 10 or so times per position in the gut. And so you're really staying between the bony landmarks of your ribs, right? So you're staying below the ribs and above the pelvis. And so there's not a ton of space here, but there's enough that you can explore around to various points in the viscera. So you find your position on the ball that feels a little tender but tolerable, and you just work with your breath. So the breath is the powerful supporter in this exercise. So you're breathing into the discomfort, and then you're exhaling and just imagining all of that tension, tightness, discomfort, just melting away on your exhale. And so you can stay at each point that you find for up to 10 breaths. And it should, with each passing breath, get a little bit gentler, softer, less intense, more tolerable. And maybe by the 10th breath, you're no longer having that discomfort. That's the goal. It doesn't always happen, but if you show up to this practice once a day, once every other day, over time, you're going to find a lot more flexibility, suppleness in the guts. If you're constipated, this can be an alternative to the ILU massage or an addition to. You want to do what's tolerable though. It's not like no pain, no gain here. You're just meeting a little bit of discomfort, but something you can stay with, and then breathing through it and breathing and seeing if you can melt the tension and the holding, the gripping. Some folks hold a lot of muscular gripping and tension in the guts, and this is an opportunity to really practice the release. And then also, this is a way you can actually self-mobilize impacted, compacted tissues and adhesions. You can help to facilitate the additional release of adhesions outside of what we did in the clinical session. And like I said, if you find a particularly tender spot, bend a knee up and see if that unweights it a bit and allows you to work with it. So you're not blasting through discomfort, you're meeting it, noticing it, and then breathing with it. So I'll just show an example of what that looks like for the full round of 10 breaths. So I'm finding a spot that feels a little bit tender. I'm inhaling fully to fill my belly and my pelvis with breath. I'm exhaling to relax and let go. And for me, I feel like my shoulders are holding on too tightly, so I'm going to change my position and support my head. So that's just 2 breaths so far. And I would continue for the full 10 breaths, and then come out of the full weight bearing and find a new spot. So maybe I'll roll onto a different area. Oh, that's a little bit of a tender spot. And then repeat the process with the full, long, slow, smooth breaths. So I hope this is a helpful exercise. I'll share a link to where I like to source the Courgeous ball from, Tune Up Fitness. There's probably many other options. Make sure you are using a ball that's relatively soft and smushy. I would never use a tennis ball or a racket ball for this. It needs to be a larger surface area ball, and it needs to be a little bit deflated so that it can sink nicely into your viscera in a gentle way. This should never cause a sharp pain or actual really discomforting pain. It should be something that improves as you continue breathing. If it doesn't improve after a couple of breaths, then lighten your weight bearing status or just move on to a different space. And of course, as always, with any exercise program, you're going to need to always follow the recommendations of your healthcare provider. So I hope this is a beneficial exercise for you. Be well.